Good afternoon, everyone, and welcome to our first panel discussion with Conversations with Attorney General Ford. I will hand it off to you, AG.
Well, thank you so much, Teresa. Everybody, this is Teresa Har, my special assistant. I thank you so much, Teresa, for emceeing this and putting in the work to help us get this moving. Hi, everybody out there. I am Aaron Ford. I'm your Attorney General, and it is my honor to be with you today and to have with me for the first installment of what we hope would be a well-attended monthly town hall discussion with my office called Conversations with AG Ford. Many of you may know who I am, but what you may not know is what all we do here at the Attorney General's office and how we're working hard to help to keep Nevadans protected. On my second day in the office, I called every member of my team together for a meeting, and I talked to them about my priority areas, which I like to call the 5 C's. To be true though, I started with 3 C's and it escalated. Now we're at 5 C's. But these 5 C's are constitutional rights, the protection of those, criminal justice and reform issues, consumer protection, client services, and community engagement. And I want everyone here with us today to know that these C's are really all about you. They're what my office uses to prioritize the ways in which we serve each of you and the ways in which we serve our state. They are why we're here today, to have this conversation and to focus on one of my C's, which in this conversation is going to be on community engagement. So on the last Wednesday of each month, I'm going to introduce you to different members of what I call the AG family. You'll have the opportunity to learn more about what we do and have the ability to ask questions about our services. So to kick off our first segment today, I have 2 members of my Medicaid Fraud Control Unit with us, or what we call the MFCU. We absolutely love our acronyms here, and so get used to that, MFCU. All attorneys general offices have an MFCU team that investigates and prosecutes financial fraud involving healthcare services or goods to Medicaid patients. This unit is here to make sure Nevadans who really need Medicaid services and are relying on them are in fact receiving these services in a timely and in a fair manner. In future sessions, you're going to hear from other divisions in my office, like my investigations team, the insurance fraud division, workers' compensation, insurance fraud division, the BCP, or Bureau of Consumer Protection, and my Office of Military Legal Assistance, which we call OMLA. Again, we love our acronyms. So please be sure to join us on the last Wednesday of every month so that we can continue this conversation. And again, I want to thank you for tuning in today. So with that, let me turn the mic over to my 2 colleagues. I happen to be up north this week because we're in the legislative session, and I come up here just to be certain that I can be available to help pass bills that are helping you. And in Southern Nevada, I have 2 of my good friends who work in the MCU division. And so let me turn the screen to them and have them introduce themselves to you as well.
Thank you, General Ford, and good afternoon, everybody. My name is Andrew Scholke. I am the Chief Deputy Attorney General and the Director of the Medicaid Fraud Control Unit here in Nevada. And with me today is...
My name's Matt Ross. I am the Deputy Chief Investigator of the MFCU. Been with the unit for approximately 10 years now, and it's my job to essentially see all of the oversee all of the investigative staff. And do whatever Andrew says, as he is my taskmaster.
Well,
I officially like to be called that. Beastmaster is appropriate, but
that'll work too, yeah. You would use those phrases though, because I jokingly say, but it ain't really a joke, I have 400 people who work at this office, so that means I have 400 bosses, and 2 of them are sitting there now at MFCU. So let's real quickly explain to those viewing this broadcast what MFCU is. I mean, we all know we've heard of Medicaid, we've heard of the word fraud, we probably can figure out what fraud control means, but put it all together for us and explain to our audience, what is the MFCU?
Absolutely, happy to do so. Yes, so the MFCU, as it says in the title, we are the Medicaid Fraud Control Unit. We do investigate, prosecute criminally, as well as investigate civil actions regarding essentially false claims that are made to the Medicaid system. So when I obviously say submitting of false claims, I'm talking about the providers that are supposed to be going out to the community or having the recipients come to the office to provide a certain service to a Medicaid recipient that is then essentially billed to Nevada Medicaid for reimbursement. So we do want to make sure we clarify that right off the bat. So we are obviously only looking at Medicaid providers. We do not, as part of the MFCU, investigate Medicaid recipient fraud. So if you do have stories about your neighbor that's out of work, that is supposedly has a horrible back injury, but is climbing ladders 3 or 4 times a day, we get those calls all the time. Medicaid's in our title, so we are accustomed to that. But that is not something we do. That is Medicaid recipient fraud. There is a whole welfare division that essentially handles those type of issues. If we get those type of calls, we happily get that information over to our welfare compatriots so they can look at the recipient fraud issues. But we do want to clarify that we only do look at the provider fraud. So when I talk about Medicaid providers, you know, obviously it's an exhaustive list, but doctors, dentists, optometrists, hospitals, you know, essentially anybody that's in the medical profession that is able to submit a claim for a type of service to Nevada Medicaid for reimbursement. So that is the majority of what we do, is the fraud element. But we do also handle abuse and neglect of elderly or vulnerable adults in medical facilities. So elderly by Nevada, and if you do learn one thing from this meeting today, it is by law over the age of 60. So if you are over the age of 60 and a resident in one of these boarding care facilities and supposed to be getting some type of obviously assistance living in those facilities, if you've been abused or neglected while living in that facility, that is something that we at the MFCU can investigate, prosecute, as well as look at on the civil side of it as well. So I don't want to take up the whole time, but if Matt has anything to add.
I think Andrew did a good job of explaining it, but what is important to note, and we get this question all the time, people are very confused by it, we are not Medicaid. We are apart and separate from Medicaid. In fact, it is our responsibility to essentially police the entire Medicaid system. So yes, we're responsible for investigating providers for fraud, but let's say that there's someone that is employed by Medicaid itself that might be doing something they shouldn't be. Maybe they have partnered with a bad provider and are doing things that they're not supposed to be. We would also be responsible for investigating situations like that.
Yeah, and I'm glad you said that, because you know we don't run Medicaid. That we have an entire state division, Health and Human Services, that has the expertise and do a fantastic job of running those things. So we won't be able to talk about or answer questions related to policies and things of that sort as it relates to Medicaid. HHS, Health and Human Services, does a great job of interacting with folks who have those kind of questions, and I want to commend them at the outset for the work that they do. But tell me this. I heard what you said, and the definition sounds great, and you know, you've explained a little bit, but give me a day in the life, and I'm gonna skip you, Andrew, and go to our colleague down there,
Sure,
investigators. Give me a day in the life of what it is you do in your job.
So as an investigator, criminal, and I should start by saying this, in the MFCU, we have multiple professionals that work here in our unit. We have obviously prosecutors, the attorneys. We have management analysts who are looking over the numbers, the claims data, doing things like that, investigative assistants. And then we also have our sworn law enforcement, our criminal investigators, who are going out in the field, conducting witness interviews, doing surveillance. They might be utilizing recording devices to get, you know, video or audio recorded, sometimes undercover, sometimes, you know, what's not undercover and everyone knows what's going on. So a lot of the times we're out in the field, but the vast majority of the time we are spending actually at the office reviewing all of the evidence. And because it's Medicaid fraud or healthcare fraud, there is a substantial amount of documents, right? That is our primary evidence source, is documentation. So, I mean, it's not uncommon to have a case where you've got 15 banker's boxes that are just chock full of papers, and we've got to go through every single one of those pages to really find that fraud. So what we do here takes a particular personality. You know, a lot of people, they get into law enforcement because they're gung-ho and they want that adrenaline and all the stuff that comes along with that. That's not what this unit does. What we do is we are putting together the pieces of a puzzle, and a lot of those pieces are paper, to figure out exactly what happened and who essentially lied to obtain money from the state improperly.
Yeah, I mean, it sounds like a very intense process there. And, I have to commend you for the work you do. We talked a little bit about my 5 C's, and to be sure, you guys investigate fraud, and people who are guilty of committing fraud against these programs sometimes get put in jail, or sometimes have criminal penalties associated with them. Obviously criminal justice and criminal justice reform is one of those C's. And people think that's really sometimes all that we do is put folks in jail. But it's not true. So the C we want to address with you all is community engagement, community involvement. Talk to us a little bit about the ways in which you incorporate that C, that priority that I've given you, and that you frankly did before I even got here. Because again, one of the reasons for that C is to let folks know we're more than just people who put folks in jail. We shop at the Smiths, you shop at. We are the soccer moms and dads like you are. We live in your community. We're your neighbors. And so we want to get engaged in the community. So what do you do both within your subject matter area and expertise, but also outside of that from a community engagement perspective? And both of you can answer that one.
100%. I'll start off if that's okay. And I think, really something that we've prided ourselves on as part of that community outreach and that community engagement is, and this is obviously more on our abuse and neglect side, but we have a program in the Nevada MFCU that's actually been up and running for a number of years now called Project SNF. We're still working on an official name for it. It's a work in progress, but it's a Project Skilled Nursing Facility. That's what a SNF is.
Yep. At least you can acronyms. Sniff don't sound right. I mean, when I was a kid.
No, exactly. Yeah, we really gotta, Got it, General. One thing we'll take from this meeting, we're going to work on finalizing that name, make it a little more, we're not looking at glue manufacturers or anything like that. I mean, this is something where Project SNF, essentially we send out, we usually try to do it once a year, obviously with the pandemic and us not wanting to go into these type of facilities unless obviously we have to, based on some type of investigation. We're trying to protect, the sanctity of the elderly and the vulnerable people in those facilities. But prior to the pandemic, we would send out a mailing to essentially all skilled nursing facilities across the whole state of Nevada, offering what we have as our outreach program to educate people in skilled nursing facilities on essentially who we are and what we do. But part of it is also we talk about the abuse and neglect laws that are in Nevada, recognizing signs of abuse and neglect that might be in these type of facilities. We make sure to impart on the people we provide the training to that most likely, because they work in that type of facility, they're a mandatory reporter, which under law requires when you see instances of abuse and neglect happening in these facilities that you have to report those instances to a state agency to make sure those are investigated. But it's a lot of times it's good to get in those facilities to essentially, again, spread the knowledge that we are here as a resource if for some reason somebody has a coworker that they think is abusing or neglecting someone. But it's also just nice to have us get out there to be as a face to something. A lot of these times when we go into these facilities and we're walking through the halls or we're seeing these residents, we want these residents to make sure that they have a voice that they can go to if they feel like they're being abused and neglected. And obviously a lot of that information is provided to the residents directly through the state ombudsman and such like that. But we have flyers and we have information as well that we want to essentially get information out that we can be a voice for you if, unfortunately, a lot of times elderly or vulnerable people are in these type of facilities because they don't have family members and they don't have someone they can turn to if they are having these issues of abuse and neglect. So we like to be able to advocate that we can be a voice for them if they feel like they have been abused and neglected in the facilities. And again, we've been doing it a number of years. It's a free training as well. It's actually certified as well by the State Board of Nursing, by the Social Workers Board, as well as by the Long-Term Administrators Board to get continuing education credit for people that attend those trainings. So it's a free training we offer. Again, feel free to contact us on information on our website, but most likely you're going to be getting a letter when we can get back into these facilities so we can essentially get Project SNF up and running again to get our faces and our name back out there.
And Project SNF isn't the only thing that we do. In the past, we've also done fraud training for local healthcare colleges as well as in-home healthcare specific fraud training for in-home healthcare agencies, where we've gone out to those agencies and discussed timesheets and reporting of the services that they've provided and various things that we look for in our cases to help them essentially not commit the mistakes that we've seen others commit in the past. And then another aspect, and you mentioned this, AG Ford, about, sometimes people look at us and think we're only here to put people in jail. Obviously that happens, but a big part of what we're trying to do is deter and prevent fraud within the Medicaid system, right? And so sometimes, and a lot of times actually, we have cases come across our desk where mistakes were made by providers, but they don't rise to the level of all-out fraud. They're definitely trying to, work the state over or anything like that. And in situations like that, we will go out to those providers, meet with them face to face, and essentially give them the Medicaid services manual and instruct them on what mistakes they've made and what they need to do to fix those things. So essentially we go out and we educate providers fairly often as well.
Correct.
No, that's great. That's a good overlap into some of the other C's in the office, criminal justice and criminal justice reform, right? We don't want to just be putting folks in jail. We want to educate. We want to avoid the jail process, and we look for opportunities to help educate folks in areas like that. I have a few other questions. I don't know, Teresa, did you want to, and by the way, everybody, this is not scripted. They have no clue what I'm going to ask them. If they start stumbling over themselves, you can blame me. But Teresa, I don't know, did you want to offer anything on this conversation?
Yeah, I actually do have a couple of questions. You guys have mentioned Medicaid fraud done in conjunction with abuse or neglect. And I think that while we have in our mind a general understanding of what abuse or neglect could be, I think it would be really helpful if you guys could provide a slightly more technical definition of those and maybe some examples of cases that your division has handled regarding abuse and neglect in regards to Medicaid fraud.
Perfect. I think Andrew should talk about the technical definitions and actual laws about this as the attorney, and I'll share some case experiences that we've had.
Yeah. No, thank you. That's a very good question. Yeah, the abuse laws, I mean, if you go to the abuse statute, and it's in chapter 200, if you ever want to go in and look at the statute for yourself, but it's a very long list of essentially what could be considered abuse. So, I mean, obviously you have the probably what you're most accustomed with, the actual physical abuse, when somebody has, the marks of an arm that's grabbing somebody's shoulder, or some type of physical sign of some type of contact or a slap or something like that. But it's also actually more than that. I mean, and really, when you look at the statute, a deprivation of food and shelter, or essentially, the ability of these elderly, vulnerable people to live their lives, that is considered a form of abuse. And we talk about this in our Project Sniff training all the time. When we are presented with a factual scenario as part of a referral, when it comes in, we're looking at it from an abuse neglect standpoint. But when you look at the elements and the facts, a lot of things that could be considered abuse are also considered neglect, because neglect, you're really looking for essentially a duty to provide some type of food, shelter, the well-being for that resident at the facility. And then obviously if you're not providing that food, shelter, and things to help them with their well-being, and obviously if there's some type of harm that comes out of it, that's very apparent neglect. But one thing in Nevada law that is maybe different from other states is that for establishing criminal neglect, we do not have to show actual harm. So by statute and by law, we only have to show essentially that a person was put in a situation where they could be harmed. So a lot of our really successful neglect cases have been situations where you have a medical facility where maybe there's 3, 4, 5, it's not one of these huge nursing homes, but a smaller type facility where maybe there's one live-in caregiver that hasn't gone through the proper TB, CPR certifications, while also living in a home that has protruding nails, no air conditioning, working in the summer, no running water, essentially painting a neglectful living condition type scenario. And a lot of times when we're advancing those cases and talking with defense counsel or with the defendant, it's really along the lines of, you're very lucky nobody got hurt or significantly suffered injuries because of how you were running that facility. So that is something that we definitely, again, talk about in our training. We don't have to show actual neglect. It's just something where it's a situation that could be harmed. Obviously, if you have pressure ulcers or anything that it's obviously evident of those type of neglect situations, that's paramount to show that that's happened. but we don't have to show that. And that's one distinction we definitely like to highlight. And I guess the only other thing for abuse that I like to highlight again in all of our trainings is that, and this was actually something that was added to the statute probably about 4 to 6 years ago, but yep, every time. If under the abuse statute, if you abuse an elderly person's dog, you can be charged with elder abuse. So for some reason, the lobbyists for cats, guinea pigs, birds, and fish have not gotten to the legislature to get them added to the statute, so it's just dogs. But as a dog lover myself, I can definitely say if you abuse an elderly person's dog, we will take a very hard look at that case, because that's just not something you should be doing. But those are kind of, in a nutshell, some of the examples of our abuse, neglect, and turn over for Matt for our case examples.
I can attest that if there is a dog involved in an abuse neglect case, our unit will pursue that with the utmost amount of energy, and everything we can do, we'll try on that one. So case examples. So I'll start with neglect. And like Andrew said, neglect in our state is a very unique statute because there does not actually have to be harm proven or shown. It's just placing a person that you had a duty to care for in a situation where they could be harmed. So that can manifest itself in a lot of different situations. You know, if you have someone who's non-ambulatory and they can't get out of bed, and you'd have to help them if there was a fire in the residence or in the facility, and you leave them by themselves, you've essentially placed them in a situation where they can be harmed. And there have been cases that we have worked successfully where that has been the case. A really good example, a more recent example of one of the cases that we had occurred at a memory care group home. So a group home is a place where people go to live and they receive a certain level of health care at that facility. The victim in this situation was an elderly male, and there were 2 caregivers involved. They had taken the man to his bedroom to help change his diaper. And so while changing his diaper, the man started struggling to breathe and eventually stopped breathing entirely and passed away. Now, this wasn't an immediate situation. It kind of happened over a matter of minutes by the time the man eventually passed away. But instead of administering CPR or even calling 911 and alerting paramedics and trying to seek additional medical attention for this man, the 2 caregivers put a sheet over his body and left him in that bed and failed to contact anyone. In fact, authorities were not alerted to the man's death until 25 hours later when the manager of the home showed up and realized, oh, there's a corpse in this bedroom. I need to call someone and have the situation taken care of. Now, on the surface, this could happen for anything, but what we were able to show through our investigative activities was that those caregivers were required by law to be CPR certified, and the policy of the home, the group home that they worked at, was in a situation where someone starts struggling to breathe, they are supposed to either administer CPR or call 911. And because they failed to do so, we were able to show that they neglected the duty owed to that victim, to that man. Now, you could argue and say that this was a situation where it was neglect resulting in substantial bodily harm or death because the man did die. Unfortunately, he was very elderly, had a lot of comorbidities, so the coroner was unable to say whether he died from that or because of heart failure or one of his other, various illnesses. So we weren't able to go that far, but we were able to show that those 2 caregivers neglected their duty and placed that individual in a situation where he did end up being harmed. And then on the abuse front, we recently had a case at another group home. It's a sad situation. They were very elderly, very disabled residents at this group home, and the owner of the home was the sole caregiver. And unfortunately, she was leaving for extended periods of time, leaving them by themselves, and they were unable to ambulate or leave. She was failing to provide them with the medications that had been prescribed to them by their physicians. And she was not providing them with food all the time, so they were severely malnourished and dehydrated. But we were able to show all those things with the help of some of our state partners, the Bureau of Healthcare Quality and Compliance, get a lot of those residents moved out and sent to other places, and eventually convict that group homeowner and get her out of the system so she can't victimize anybody else. So those are just 2 examples of the abuse neglect cases that we've worked recently.
Yeah, no. Sorry, go ahead, Teresa.
And I think that in common parlance, another term that often gets used in conjunction or interchangeably with abuse and neglect is exploitation. But I think it would be helpful if you could explain how that's legally different from abuse and neglect and what that means for your investigations.
Sure. So, yeah, absolutely right. Exploitation is obviously you're talking more of a property type crime, whereas abuse neglect, it's actually a crime against a person. Because exploitation, you're really trying to use some type of undue influence, and again, for our scenario, it's against an elderly or vulnerable person, to essentially try and obtain some type of property from that elderly person using that undue influence. So obviously it could be classic as cash, ATM card. Sometimes it gets to the level of the quick claim deeds of the houses or pieces of property and those type of things, but it's obviously much more of it's a monetary crime, and essentially the penalties associated with that also are more towards the monetary side. I think it's over $3,500. It gets up to that category B felony level, and it's all stratified based on the loss amount, where obviously if you're talking about a house, it's not that hard to get to a pretty high level felony level for the exploitation. Whereas on the flip side, for the abuse and neglect aspect of it, those are really tied, and especially when you're looking at the categories of crimes, to the actual amount of harm that was done. As Matt just mentioned, if there's been substantial bodily harm or death, then that jumps to that category B felony level. Whereas the most common forms of just the first instance of abuse neglect, or where there hasn't been a situation of substantial bodily harm or death, those are all at the gross misdemeanor or category C felony level. So it's really, based on how you look at it, with the penalties aspect of it, is it, again, what happened to that person and the physical, injuries they might have suffered, or based on neglect, what they might have suffered, compared to the monetary side of it, exploitation of how much money or how much property that they obtained for that person. And obviously we at the MFCU, our jurisdiction's a bit limited when it comes to exploitation. We're really looking at situations where it's a Medicaid recipient that's inside one of these board and care facilities that essentially Medicaid will pay that resident, gives them about $35 a month to live for sundry type items to live in that facility. So it's to buy toothpaste, toothbrushes, hair combs, that kind of stuff. Well, obviously, if those residents live in those facilities for a number of months, years, that money starts adding up, and they're not exactly spending that money very frequently, so it adds up quickly. And we've had some instances where, unfortunately, caregivers in those homes will then use undue influences, sign this withdrawal slip, buy me a TV, something like that. And obviously, whenever that's Medicaid money that's then been exploited from the person, that's where we kind of step in and will help get that money back on behalf of Medicaid.
Yeah, I think the simplest way to discern between the two categories is abuse neglect involves the physical or emotional or psychological health of the person, where exploitation involves their property or their money. That's the easiest way to discern between the two categories.
You should have answered that 5 seconds. I took 5 minutes. Sorry.
That's perfect. So we actually just got a question come in that was, if someone suspects that someone is a victim of Medicaid fraud or abuse or neglect, how do they go about filing a complaint so these things can get to your guys' team to investigate and prosecute?
Great question, and I'm actually going to look off my notes here because I do have the phone numbers that I want to make sure I give out accurately. Okay, so there's a few ways to do that. By telephone, we have 2 offices. We have an office in Carson City, and we have an office here in Las Vegas. So for our Northern Nevada office, and just to be clear, we do have jurisdiction over the whole state, not just Carson City and not just Clark County. It is the whole state, but those are our 2 main offices. So for anything in Northern Nevada, you'd want to call 775-684-1191. And for Southern Nevada, you want to call 702-486-3187. And I should say that it doesn't really matter which one you call. It'll come into us. We review all the referrals that come in. So if it happens in Clark County, but you call the Northern Nevada number, that's not a problem. It'll get to the right place. And we also just recently instituted a new MFCU intake email for any and all complaints that can come in. That's probably the most effective way, because you can put everything in there. It goes right to my inbox, his inbox, our intake staff's inbox. So everyone knows that there's an email or a referral in there or a complaint that needs to be addressed. That email is mfcuintake@ag.nv.gov. And then, of course, you can always go to the Attorney General's website and file a complaint on there, and that's ag.nv.gov. General, you're muted.
Thank you. It sent me a message that said, you're muted. Okay, here we go. But notice what he did not say. He did not say send a Twitter message to our Twitter account. He did not say go on Facebook and send a messenger message. Those are not the best ways to get information to this office. And in fact, it's highly likely that the information will not get to the offices. And so please take note of those numbers that he just shared with you. The website is a very easy way to do it, ag.nv.gov. And then the email address, he said, was mfcuintake@ag.nv.gov as well. So thank you so much for that. We are coming up on our time, and I want to be considerate of everyone's time. If you haven't been able to figure this out, I don't know anything about this. That's not true. I know a little bit about it, and I don't have to know anything about it. The truth is because I have some great folks on this team at MFCU. In fact, they are leaders, not just in the state on this issue, but throughout the nation. Andrew, am I right that you're on the national board that relates to MFCU related issues? And so just know that we here in this state are dedicated to protecting all Nevadans. And so we are proud to have introduced you to our MFC unit on today. I'm going to ask that you tune in next Wednesday at 4 o'clock for the next Conversations with Attorney General Ford. And I'm going to tender the mic back to Teresa Hart to close us out. Thank you so much, everybody.
Thank you, Attorney General Ford. And I do want to note, just for COVID safety, while it looks like Matt and Andrew are larger than that table, that is a very large conference table they are sitting at. They just happen to be big guys, and they are sitting more than 6 feet apart for social distancing. I just wanted to note it. I know they make that table look really small, but it is a very large conference table. And with that,
I need to say, Teresa, I did need to say one more thing. I gave a task to my new Chief of Investigations, William Scott, to help us to put this kind of stuff together, to come up with ideas to get involved in the community. And this was one of his babies. And so, Chief Scott, I want to thank you in front of everybody right now for helping to facilitate this. Great job. This was a great guinea pig session, and I look forward to many more to come. So, thanks everybody. Y'all have a great day. Bye bye.